Max Lee is going to start us off. Max is faculty in both aerospace and the IOE department, and is going to talk about some stuff that has absolutely nothing to do with healthcare. And you're all going to listen intently and learn interesting things. And then he'll stop and have a cupcake. And then Dana Habers, who is our Chief Innovation Officer for Michigan Medicine, is going to talk a little bit about pharmaceuticals and pharmaceutical delivery. And some of you might start to go, flying monkeys are kind of like. And then we're going to bring it all back together and we're just going to see how it goes. So, Max, I think we're starting with you.
That's good. Step up here. Okay. Welcome. First of all, I love the music that was playing in the background. It's very nice.
Very nice.
So great to see you all here, and thanks so much for having me. First caveat, this is like the first healthcare related thing I've ever presented at or been to. So forgive me if I'm a little nervous and go easy on me. So what I'm gonna do for the first 10, 15 minutes is to talk to you a little bit about drones. Some of you might have actually played with them. Some of you might have seen a couple buzzing around. So I just want to give you some perspectives on air traffic control for drones, and then sort of this kind of insidious privacy risk thing that kind of creeps in. So this is joint work with a bunch of folks here at Michigan, as well as this is some strands that I started at the very end of my PhD, and then a very good colleague of mine at Stanford as well. So would not be possible without these collaborators. First things first, drones are probably coming. Amazon is testing their prime air delivery systems. Dana will talk to us much more about the usage of drones potentially for medical supplies. Some people are even thinking of using drones to deliver AEDs for buildings that don't have them in case if someone has a cardiac event. Also, one of the bigger use cases, some of this has already been deployed in some other countries, is the usage of drones for food delivery. So your Domino's pizzas or your Chipotle's. And then just broadly, big box stores, Walmart, Target, etc., have been looking into drones as well. So a lot of these services are still in the trial experimentation phase. Zipline has had a pretty big operation in Africa, and they're kind of trying to expand within the US. And again, Dana will talk more about their partnerships here. Now, if we're gonna have all these little things buzzing around in the air, right, in the airspace, just like how we do for commercial air traffic, when you get on a plane with Delta Airlines and you fly, there is some sort of tracking and surveillance system constantly on that plane. There's some exceptions when you're over the oceans, but when you're flying a domestic flight, you're either being tracked by radar or you're being tracked by satellite-based stuff or ADS-B. There's a bunch of systems that are out there ensuring that someone knows where the real position of your plane is. So now you think, okay, this probably makes sense to have for drones too, right? We probably need some sort of air traffic control and radar system for drones. And the US government, as well as other governments, said that makes sense. We should probably have some sort of radar for drones. And so we have come up with this system called remote identification, or remote ID. For all intents and purposes, you can just think of it as the drone is required to broadcast its real-time position, velocities, altitude, and owner ID. And this is pretty logical, right? If the drone is somewhere it's not supposed to be, you can track it, figure out who the owner is, and slap them with a fine, etc. So from the FAA's remote ID website, the FAA is the Federal Aviation Administration. Remote ID is really laying the foundations for more complicated, higher density drone operations. So these are sort of the fancy visions that NASA has for the future low altitude, high density airspace. And if we want to get there, then we need some way of making sure we know where these drones are. Right? So everyone on board with this idea of radar systems for drones? Now, this has already ran into a couple of issues. So there's this guy, Tyler Brennan, who owns a company. I guess he does like drone racing or something. So he said, well, if you're gonna have remote ID, that means the government can track where my drones are at all times, which means that they could actually seize my personal property. And he claimed through a lawsuit against the FAA and the US government that this is a violation of his Fourth Amendment rights. That, this opens him up for, unconstitutional searches and seizures. This was unanimously struck down through the DC Circuit Court. So I love this particular, so I actually just took this directly from the opinion. It starts with drones are coming, lots of them, they are fun and useful, but their ability to pry, spy, crash, and drop things poses real risks. The entire purpose of the FAA is to ensure that we have a safe national airspace system. This falls clearly within their mandate and purview. So this remote ID system is constitutional, and Mr. Brennan lost his case. Now, I guess you could still appeal to the Supreme Court, but I think they have bigger things going on. So all this is to say is, one, remote ID is probably here to stay. And two, that some people are already starting to get a sense for there might be a privacy issue here because of this real-time location tracking thing going on. So one thing that I want to highlight is this paragraph here, which comes from the FAA when they were defending the remote ID system. They say remote ID will never be matched to personal identifiable information unless if it's required by law enforcement, right? So this is what they say, that we'll never try to connect it with your PII data unless it's required. So again, the remote ID rule, logical, we need safety, we need a safe airspace, but these rules have ramifications. So imagine maybe one of you entrepreneurial type students, you realize that remote ID is really just publicly broadcast on Bluetooth channels, and that's exactly what it is. You say, what if I just go around Ann Arbor and I set up some Bluetooth receiver modules and I passively collect these trajectories for a year or 2 years, and then see who I can sell this to. That's which is perfectly legal and perfectly possible. Now, if you're able to do that, imagine this is almost like if I ordered something through Grubhub and someone ties like a giant balloon to the back of my Grubhub delivery card that says, Max Lee ordered fries from some location, which, okay, fine, maybe if it's fries, I'm not like that, I don't really care if you know where I'm getting my fries from, but suppose if I had some sort of medical condition, or if I had some, facet of my lifestyle where the purchases that I make could be extremely sensitive, right? So it could, maybe I don't want people to know that I shop at certain grocery stores, or maybe I don't want people to know that oops, let me go back, I get medication delivery from a specific source. So this is for if you do like door-to-door delivery from somewhere that is easily identifiable as selling something that might be a little sensitive, right? Maybe it's marijuana, maybe it's alcohol, maybe it's something that just, you prefer people not to know that you're buying. Now, some of you might say, okay, what if I'm getting drone delivery from like a Walmart or like a Target or something? You don't, just because you know that I'm getting drone delivery from a Walmart doesn't mean you know what I'm buying, right? And true, this is correct. But now imagine you're that group of entrepreneurial students, you've collected these trajectories, and then you approach Target and say, hey, can I sell you all of the trajectories of people who have received drone deliveries from Walmart? Target's like, oh, these people might be amenable to drone delivery services from me, right? They're already getting drone delivery service from Walmart. Maybe I'll hit them with targeted, no pun intended, targeted advertising from Target of my drone delivery services, right? So vendors now might even care that you could actually potentially use this data set to identify customers utilizing rival services and hit you with them with the unwanted targeted advertising. And also, I think nowadays there's kind of a bigger and bigger cognizance of privacy. And perhaps if customers care, maybe vendors will care just because customers care. And then finally, this was raised to me recently, which was, this is kind of an interesting point. So say if maybe I'm a more high net worth individual and I always, get the latest iPhone when they come out or get the latest jewelry from Tiffany's or whatnot. I probably don't want people knowing that that's exactly what I'm getting, right? So depending on, the types of places that you're actually getting stuff from, that could potentially open you up for, revelations of something about your socioeconomic or demographic factor that you may not have wanted people to know. Okay, so to drive home this point even more, on the left here, this is unfortunately for you entrepreneurial students, someone has already wanted to do this. So someone has already created a company, Air Sentinel, that does this kind of drone tracking. And on the right here was this fascinating article that I found recently about this multi-billion-dollar location aggregation service. So this is not related to drones. This is just related to like your cell phone data, et cetera. This is drones related. But what I wanted to kind of bridge the gap with is that this in the middle here is the list of like 46 location aggregators that currently aggregate your mobile phone data. And on the left and right columns are the current state of proliferation of drones in the national airspace system. And the TLDR summary of the left and right column is that there's already a lot of drones out there. And this number is expected to only increase. So the fear is, are we going to get to a place where we now start having, location aggregators for your delivery drones data? And okay, maybe it won't be multi-billion like phone data, but maybe it'll be at least a relatively large industry. So this is sort of the doomsday scenario that we may not want, right, in terms of drone delivery service. So this is where I'll end. There are a lot more things that I can talk about in terms of the technical research of what we're doing. So we the very first paper that we wrote on this, we just wanted to ask ourselves, how do we even begin to quantify this privacy risk? And the way we decided to do it was through this sort of probabilistic privacy quantification. So basically, if I observe a drone flying from a vendor to Amy's house, I'm like, okay, 100% someone there bought something there. But if that drone has capacity 2 and I ask for it to go to another pickup location and then go to Amy's house, I've now reduced her privacy risk to a 50% chance of guessing what she got, right? So that's actually the basic idea of this probabilistic privacy quantification work that we did. And then we looked at various ways of calculating and measuring this privacy. We then asked ourselves, do consumers even care about this privacy risk? So what we did was we conducted a large online survey of about 4,000 US customers in order to give them different choice sets of, here's a ground delivery option with a certain price, and here's a drone delivery option with a certain price, and yes, no privacy. So collecting enough of those responses, you can instantiate a discrete choice model and actually try to figure out what is the utility, the time and price utility of privacy. So that's in review. I'm happy to share a preprint, and any of the last 3 I'm happy to share a preprint on. The third part might be of interest to people who like optimization. So what we realized was, well, if we have drones and we have a bunch of vendors and a bunch of customers, if we're just a little bit smarter about how we do the vehicle routing problem, we could actually implement privacy. Yes.
So I'm going to break the ice by asking a clarifying question to encourage you all to be asking clarifying questions, but I also have the question.
Yes.
That means a drone can carry more than one thing at a time?
So there are drones out there that can carry up to 3. So we have capacity 3 drones, but even for capacity 1 drones, we can think about we call them dummy vendors. So think about a drone, it can only hold one thing, but if you're just observing its trajectory, if you see it going to a vendor, you don't know if it picked something up or if it was just there to charge, right? So we can actually put in some random noise through these decoy vendors as well. So we haven't really explored that mathematically, but we proposed it as a potential idea. Good question. Sorry, I should have clarified that. So anyway, so we could solve the vehicle routing problem, but with privacy constraints. And there are some nice decomposition tools that we did. We said, okay, why don't we first identify a family of routing solutions, and then each family of routing solutions has a fixed privacy value. Then we perform a full-on vehicle routing problem just within that family, so that now we can optimize for efficiency within a fixed privacy constraint. Yes.
Have you looked at like database solutions? So
Like differential privacy type solutions?
yeah, like let's say we do it geographically. So geographic data for the routing in the area where the vendor is on one database, and geographic data for your house is on another database.
Yes.
And if the government has like a concern, then they can submit a request and put it all together. But in general, the data is decentralized.
Yeah, so I think that's a great solution. The only issue with remote ID is that it's supposed to be like publicly available and like publicly accessible. So that would be a regulatory type solution, right? Another solution that falls under that same class is, what if you scramble the the drone ID, right? So maybe the drone, every couple seconds, it flips its ID and you can't track it. Again, the FAA would hate that, because that would really defeat a lot of the air traffic control purposes. But there are certainly regulatory solutions. In addition to these, are more like for example, let's say if Amazon realized everyone is willing to pay $1 extra for privacy, then they could say, okay, I'm willing to make my routing $1 less efficient if I can increase privacy, but I charge you $1 more. So these are very much technocratic solutions rather than regulatory ones, but certainly I think these are. This is a conversation that I've been having with Florian Schaub, who's at the School of Information, and his whole spiel is like digital privacy, right? So I think he comes from it from a much more regulatory perspective, and clearly some of the IOE influence is coming in through some of these solutions, but this is not, I don't think, an easy problem to solve. Okay, and then the last paper here, and I have some of the co-authors in this room, actually, Yusuan and Hojun. So what we wanted to do. So this is, if I could break this down, maybe this is like the initial paper. This is like the kind of civil engineering paper. This is like the IOE paper, and this is like the aerospace paper. So here in the aerospace paper, what we said was, well, these remote ID broadcasts aren't 100% covered, so that your city isn't 100% covered by these remote ID broadcast modules. So if you don't have 100% coverage, that means in the gaps of coverage, you don't know what your drone is doing. If you don't know what your drone is doing, if there's a lot of vendors within that gap, maybe you have some plausible deniability of like, oh, you don't know if I actually ordered that because you didn't see it for this 15-minute duration. So how do you know it didn't land at someone else's house, deliver it, pick something else up, right? So can we quantify this level of plausible deniability? So with that, I think that's the end of my spiel.
So before we transition over to Dana, you know the drill, we need some questions and we need some ideas and we need some concerns about ideas. And I'm gonna pretend to give you the freedom to volunteer before I start volunteering you. Iman, go for it.
I'm not entirely sure why. I mean, I guess it's free advertising, right? If they advertise their drones, but I mean, to kill the whole privacy issue, can't you just black out every drone, all the packages, just make it just completely traceable, basically?
So the very difficult thing here is that this system is for safety, right? Like this would be basically like saying, well, I don't really want to know where Elon Musk is going on his private jet, so I'm going to mask everything in the air traffic control radar system, right? Which is, I mean, sure, you could do that, but that defeats the primary purpose, right? The issue with this is the primary purpose of remote ID isn't so that people can track what you're delivering, right? The primary purpose is safety, traffic management, airspace management, and so on. So it's like, this just happened to be sort of like a weirdly insidious like side risk that popped up because we need to monitor where people are in the airspace, right?
So can you follow up with a clarifying question about that? So the issue is I need to be able to figure out that that drone right there is Max's drone so that I can say, hey, Max, your drone is about to crash into my thing.
Right.
And get it out there, right?
Right.
Do I need to know that it's a target drone, or do I just need to know, here's who you contact to get this drone down from the sky, right? You know what I mean?
Yeah, so I would actually argue, I don't think you need to know anything about the drone. The fact that I see the drone originate from a Target warehouse and the fact that I see it land at your house is enough for me to be like,
yeah,
Amy
okay.
ordered something from Target, right?
Okay.
Assuming I didn't do any of the routing mitigations or potentially, you know, the ID swaps and stuff
So
like
even
that.
if there wasn't a label, there was just a ping and everybody sent the exact same identical ping, but it was a ping specific to that.
Now,
drone.
I could potentially see you have a drone from Walmart and from Target, they happen to cross midair and then you swap their IDs and then I'm like, okay, now I don't know if Amy ordered from Walmart or Target. So we've thought of like fancier, I mean, a super low tech solution, I think, is if all the drones just deliver to like an Amazon locker type thing, right? So if the drones all deliver there, then the best that I can say is I know someone in this neighborhood ordered from XYZ store, right? So now your privacy is now a function of like, you know, the amount of aggregation you have around that Amazon locker. Now certainly some drone companies are thinking about that, right? But others are like very much, no, we're doing door to door because that's what, you know, that's what people want.
So I'm gonna push harder on that. So somebody who wants to get theirs out of the way and then be able to just snooze for the rest of the talk, except you won't be able to. And then I'm gonna come back to the two of you. Why might somebody say, no, the Amazon locker option isn't a viable option. It has to come to my house.
Might be just an accessibility issue. It's like the drones help a lot with people who can't leave their houses or like they have kids or they're just unable to leave. So drones is a big help with that.
I love it. Go ahead.
Like some people also, it takes away the convenience of the whole thing, because if you're like, well, if I have to travel and go to this Amazon locker, why didn't I just go to the store?
Go ahead.
Urgency,
What's that?
urgency,
Mhm.
if you need it in a specific time frame.
Which brings us back to a lot of the equity issues that we talked about last time, right? Is who has access to, as we start adding these layers on, who's
Mhm.
impacted by them. Go ahead.
I have an idea about the Amazon locker. Does it has to be a specific like physical place? Can it just be a IP address or something? So like when whatever like Target or Walmart grocery goes to that specific location or around that location, then you renew the IP address so that in the system only knows that some like the Target thing is going to that Amazon locker, and then it will come from the Amazon locker to whoever actually purchased the thing.
Yeah, so I think what you're touching on is this idea of like third-party aggregators, right? Whether it's digital aggregators or it's physical aggregators. And there was a really nice white paper from the MIT Media Lab that talks about this idea of like private aggregator networks for like a digital nomadic workforce. Again, I think similar to the locker idea, any sort of aggregation will help, right? Any form of aggregation in this case will help. In fact, all of our routing solutions essentially tries to aggregate a bunch of deliveries before going to, tries to aggregate a bunch of pickups before going to deliver, because that lowers any individual's instantaneous risk of being identified in terms of linking a vendor to them, right? So any level of aggregation helps. The question is, do you aggregate it physically through some of these routing solutions, or do you aggregate it in cyberspace, right? Where maybe you have more flexibility to also incorporate some differential privacy ideas, right? You can't really introduce differential privacy and noise-based masking here, again, because the system is supposed to be like safety critical, right? This would also be like if you didn't want to track Elon Musk's jet, so now to every flight's trajectory in the national airspace, you added some noise, which would be horrible, right? In terms of conflict resolution, safety, separation and stuff like that.
So let's take one question here and then
I don't want to disenfranchise our folks on Zoom, so after we take this one question in the room, we'll just pause until someone on Zoom has a question or a comment. Go ahead.
It's me, right?
Yeah.
So I should talk about this aggregator. If we introduce this third-party aggregator to this whole system, what the aggregator benefits like from the most from this, right? And it's the information collector and receiver and also the provider to the another drone if they want to transfer the goods from their, I don't know, the locker or anywhere, but he had to control the most information in the system. Can we trust the aggregator?
Yes, exactly, right? So it becomes this snake eating its own tail thing, right? Like exactly, which is why we landed on some of these routing based solutions, because we could say, okay, we don't need a third party. All Amazon, I'm picking on Amazon, but it doesn't have to be Amazon. Like all Amazon needs to do is to say, how much are people willing to pay for privacy? Oh, you're willing to pay $2 more. Okay, I'm willing to make my routings $2 more inefficient if it means raising your privacy protection, right? So now you've cut out, I guess now Amazon is economically incentivized to give you some privacy assurance. And that's also where that whole consumer survey paper came from, right? Because we were like, how much would people be willing to pay for this? So you're absolutely right. The moment I introduce a third party, now do I trust them? How do I know they're not going to leak my information? Because now they know everything, right? That third party knows a lot of things, right? And also, how do you compensate them, right? Because they're most likely aren't doing this for free. So we were like, that's like a very hard problem. So we're just gonna try to see if we can solve it through routing or plausible deniability and stuff like that. But maybe that's the entrepreneurial opportunity, right? If you find a good mechanism design solution for being the third party, and that actually like some sort of mechanism that would incentivize participation, but wouldn't cause too many issues. I'd have to think about that a little bit more, but we wanted to avoid that whole mess. So that's why we went through the routing problem.
All right, so we'll open it up to Zoom. Do we have how many do we have on Zoom?
14? 2 of them are me, but
So maybe 12. All right, folks, we will give Zoom a moment to catch up on.
I think there's a pop-up.
We have something?
Yes. Seems that the approach keeps honest folks honest. What happens if someone doesn't transcend?
Does that like, so I guess my clarifying would be, you mean like someone transpond?
Yeah, that's the
Oh,
doesn't transpond.
yeah, that's a good, okay. So basically what happens if someone doesn't comply with remote ID? I think the current thought is similar to if you have an aircraft in the sky right now and they suddenly turn everything off, that would raise a lot of red flags, and immediately like F-14s would get scrambled, right? Like, so drones probably it wouldn't be as traumatic, but if a drone was starting to stray towards some sort of flight restriction zone, stuff like that, it would be similar. If so, like right now, this is all very hazy in terms of what is the enforcement. People don't even know, like, if you are remote ID compliant, but you're going into the big house during game day, like, do you shoot it down? Do you because it's going to be kind of slow tracking the actual operator, right? So it's kind of, remote ID was the first regulatory step, but there's not really been anything beyond that at the moment.
All right, so we're going to go for it.
Question. So if all the solutions are like routing based, how would that impact like delivery times? Because it's like the main function of drone delivery that can really fast and quick.
Yes, absolutely. So the way that we thought about it was if it's fast food or if it's less sensitive items, you wouldn't do this, right? You would still just route it. If it's something like birth control, or if it's something, if it's something slightly more sensitive, then the question we would ask is, okay, perhaps you're willing to take a 10-minute penalty in order for us to kind of route this around a bit. There's certainly a efficiency hit. In fact, we show a lot of these nice Pareto curves of like efficiency versus privacy. And so there certainly is a trade-off, and that's a trade-off you have to live with, right?
I'm gonna switch us over to Dana for a minute. I'm gonna put a question out there for you to think about, which I think will become relevant when we bring data on, and then the floodgates are open, speak. Is speed the only reason that I might want to use drone delivery, either as the vendor or the purchaser or any other stakeholder, right? So everything we've talked about in this last little bit has to do with speed to get to the Amazon box or the speed of delivery or anything else. I just want you to be thinking about why else might I want to use drones if it wasn't because drones are faster than the alternative? And just hold the thought. Hold the thought and write it on your card, because then you'll be done. Okay, so we'll move on to Dana talking about something entirely different, except it won't be so different. So Dana, I'm just gonna let you kind of show things as you went.
Thank you. Thank you for having me. I'm Dana Habers. I have no knowledge whatsoever of drones other than what I've learned through the process of developing a partnership with Zipline, which I'll share a little bit more about, in order to meet a really important patient care need. So I feel like, so our neuroscientists often say time is brain. So I feel like your question about timing is like, I should be giving a speech on neurointerventions. So briefly, the Office of Innovation, what we do is we translate sort of strategic operations into operations. And we're really focused on a specific problem. I've been in healthcare for about 20 years, and in that time, a lot has changed. The one thing I will say that has not changed is the pressure on us as healthcare providers to do more with less. So our continuous quest, and Amy knows this very well, is to do more for our patients. We expect better therapies, we expect faster service, we expect access, we expect a lot. And yet reimbursement and the kind of economics around healthcare are not designed to reward those advancements in every scenario. So we do a lot to try to figure out products, services, new business cases, business models to drive towards that journey. And the key drivers behind, there's so many puns in it. So like if I crack a smile, it's because there's probably a pun in there, and you can like play a game around it. For those of you not here, like play like, yes, there's so many puns in drone speak. So it makes me happy to talk about them. For drones at University of Michigan Health, so we have just brief background, we have a pharmacy that's an in-house pharmacy. We have a team of about 600 people in the Department of Pharmacy, and they provide care to nearly every single patient. If you've ever been a patient in any healthcare setting, you know that prescriptions or drugs are a big part of many therapies. If it's just as simple as pain management and pain control, or something as extreme as life-saving chemotherapy, drugs are a part of a lot of things. So that team provides care across the spectrum. We provide care at home for patients, which is where this comes into play. We provide care in an ambulatory setting where patients are coming in and seeing a physician or a nurse practitioner and getting care on site. We do a lot of virtual care that really exploded during the pandemic, as you can imagine. And then, of course, worst case scenario, we have patients in the hospital. So that's a whole construct of pharmacy services underpinning this. And one of the outcomes that we anticipate from this drone delivery service is sort of threefold, and I'll talk in depth about each one of those. So the first is the quality of patient care. The second is our cost savings. And the third is our environmental impact. So hospitals and health systems, I'm going to go in reverse order, play a really big part in community health and well-being. We know that if we lead by example and we provide good patient care without a negative impact to the environment around us, and that's socioeconomic, that's environmental, we're going to see a healthier community. So in some ways, we want to try to put ourselves out of business and make sure that we have access and capacity for the people who need us the most, who are truly the sickest, and that we're not contributing to a poorer health in our community around us. Cost savings, again, we do not have a reimbursement model in healthcare. I'll spare you a very boring lecture about healthcare economics. I've given that before and tried to make it fun, but it's just very complicated and messy. And there's a lot of like dollars leaking into private industries, and like our insurance construct in the United States is a mess. And so there's a lot around that. But ultimately, as a healthcare provider, we're constantly seeking ways, particularly with prescriptions, to lower out-of-pocket costs and to make it more accessible for every patient who needs it. There are a lot of stats and a lot of articles, publications that talk about the likelihood of patients following a prescribed therapy, and financial out-of-pocket cost is one reason, the primary reason that people do not. So we're on a continuous quest to try to make it more accessible and make sure that when in good intention, the provider seeing that patient who has here at Michigan world-class expertise says you need this, that they have what they need to get that and get better. And then quality, we've done a ton of work on this in the last 2 years since I've been involved in pharmacy, and have some quick fun data to share about kind of what we're seeing in terms of people's ability to follow through with their therapy if they're getting timely access to their medications. Not to spoil Amy's question. I'm gonna show you a quick video of zipline drone delivery because I think it also answers some of the really like practical questions that popped into my head when we first started talking about this, about like, I live in a neighborhood, do I really want that noise around me? And what happens if it falls on my dog in the backyard? And like, you know, so let me show you a brief video. Hopefully this works.
The reality is like the vast majority of packages, on the order of 80–85% of packages in e-commerce are 5 pounds or less. It isn't philanthropy, you know, it's about sustainable business models we can actually use to expand access both to healthcare as well as a variety of other economic opportunities to people on Earth who have typically been ignored by logistics networks or by technology companies in general.
Just want you to see them. Deliver the mothership drone up top, hovering hundreds of feet above you, which is literally silent. I have experienced it myself. Let's see, maybe I'll have to get back to the presentation. First.
Oh, I think it's in the tab. It's in one of the tabs. Yeah.
So you saw the model, and this is a new model, so they don't actually have it all working together yet. So I have really fascinating conversations with the engineers at Zipline, many of whom are U of M alumni, by the way. It's really fun to see them. And they're working on several pieces simultaneously to bring it to market sooner. And then the idea is to bring all of that together. So the key areas of focus for them, and Mark Rober, if you're like a big YouTuber fan, did a great clip on Zipline. So watch it. It's nice homework, like nice little. The sound and the acoustic engineering around the drones, the ability for the drone to detect other things in the sky, birds, other drones, airplanes. They have a lot of built-in technology to avoid collision and redirect. And then of course that precision, so that baby drone that comes down and has our little prescription in the belly, and the delivery. I sat on a outdoor coffee table sofa set at their headquarters, and they delivered it literally on the coffee table in front of me. So that precision is super important for us, making sure if we're sending something to a patient's home, we know that it's potentially life-saving. We want to get it to the right patient. Privacy is a big issue. We don't want to deliver it to the wrong place. We also want to know that it got to you so we can follow up, do that virtual visit with your pharmacist, make sure you know how to inject the pen and take the medication and get started. So there's a lot of kind of moving parts in there, and they haven't all come together yet, but we're excited and we're happy to be partnering with them because there are so many operational components that we can help influence. So please.
From the zip line, like the part that comes down, does it like, how does the package come out of it? Does it like drop it out, or you have to like open it, or how does that go?
No, it's self-serving. So it has a little hatch on the bottom. Not an engineer, sorry. It's got a little hatch thing, the mom and the baby drone, and it just delivers and drops very low to the ground. The baby drone has, you can see in there, its own navigational system and deals with like wind. So the distance between the two, it's going to impact the weather that it's facing down near the ground versus where the mama drone is up top. So there's a lot of like self-navigation even built into that little drone. It's not a tethered box that just dumps. It's very smooth. It's very impressive. Good question. So quickly, oh yeah, go ahead.
Yeah, I have a question. So you talk about I think Michigan Medicine haven't take that June, right? So it's just a potential plan for the June delivery pharmacy use, right?
Yeah.
I'm wondering, what is the potential range for your June delivery? Yeah, like how many customers you want to reach out and basically how large the area is.
Yep, great question. So I put a little bit of that on here, but so as a whole, our pharmacy home delivers about 250,000 prescriptions per year. We anticipate based on we have an office of patient experience, so we do some surveys of patients who are existing Michigan Medicine specialty pharmacy patients. And we say, hey, we have this drone option. Would you like to get your delivery done through that mode, or would you prefer the truck? And in that survey, we had about a 25-30% adoption rate. There's a geographic distance because of the battery life of the drone. So our new facility will be located in Dexter, and we anticipate starting with about a 10-mile radius around. But, and you'll see a map here in a moment. The idea is to build a network of, they call them nests or the docking stations across the region so that a patient who lives further than that distance could potentially have a prescription, make a stopover, charge up, and then go. So we're building that network of charging stations as part of the Tesla model, right? It's like within a certain distance, they know you can always get there between battery lives. So does that answer your question?
Yeah, thanks.
Yes.
Sort of in the whole vein of like trying to find like charging stations and how you would design those. I know that obviously like now we're veering towards like electric cars and things like that. So how do we replace the traditional gas station with like a charging station? Would it be possible to just like have a charging station like linked to the car charging stations, or will you have to have them more frequently? Like how far can one of these drones go between deliveries without needing another second charge?
Right now, the current model is 10-mile radius. So I imagine that'll continue to evolve as they improve the technology or think through weight and distance. And we did some testing so let me just keep going, and I think I'll answer some additional questions. I'm going to come back to that one last since we're on this subject. So the environmental impact is very clear. Right now, we deliver all of our prescriptions through the fifth option that you see on that chart. So our ability to really improve our carbon footprint is tremendous. We also, that's the network of nests that we have planned. This is a draft, so there's a lot of capital approvals that need to get done still to get all of this built. So don't go tell the board of University of Michigan Health that Dana's spending money on drone nests yet. We'll get to that. But the intent is you can just see the geography and the spread. So the intent is to try to make it more accessible for more patients. I think someone made the point earlier about patient access and not being able to get to somewhere to pick up. There's like significant challenges, especially for some of the patients that we serve who are really unwell, who may not want to leave the house and expose themselves. They may have immunocompromised. They may just not feel well enough to want to go to the drugstore. A lot of reasons. May not have transportation. So we're trying to make it as widespread as possible. And then I think the last piece of it is that in the time that we save, we are able to potentially reduce the number of styrofoam coolers and ice gel packs that we see like a heck yeah back there. Right now, to meet our regulatory requirements in the pharmaceutical industry and our licensing and inspection agencies within the state of Michigan, we have to package all of those for 48 hours on a truck, even though most of the deliveries happen in 24. So we're using coolers, even for a little tiny vial or one injectable, styrofoam coolers and gel packs. So we use this whole like system to make sure that we're preserving the integrity of the product that we're delivering to you. You don't want to inject something that's not good. So that's very important to us. And we have extensive testing to make sure that that's the case during the drone journey as well. But we anticipate not needing that. If you can do a delivery in 15 minutes, we may not need gel packs. We may be able to just, similar to like taking something from the pharmacy and putting it in your car and making it stop to charge up on the way home and then getting home. So we think that there are a lot of opportunities, not just with the delivery itself, but subsequently in our packaging and just reducing. And that's kind of it's a big patient complaint. These are bulky and they fill up their garbage bins and recycling bins, and it's super annoying. So we think we can solve for that too. Yeah.
Are these paid for through an app or the patient's billed later? Or how does that work?
We actually don't charge for delivery. So they won't pay anything beyond what they normally would for their prescriptions out of pocket copay. And because we're delivering at home, we collect those payments either through the patient portal or on the phone.
I have a quick question about the carbon emission that results you showed us on the UAV compared to the cars. So I'm wondering what kind of environment you are considering, because we all know in the higher altitude, in the higher operational altitude, we will have strong winds sometimes. Yeah, so what kind of environment you considering to propose such a result?
Yeah, so we are the 10-mile radius is a fraction of what we think they're capable of. But we're in Michigan and batteries also don't last as long in the cold weather. And we have a lot of, high winds and things that you're describing. So we're starting with that. I think ideally we're not using that entire charge on the trip, or we could potentially add other patients in that region and deliver multiple times, things like that. This map corresponds to our ambulatory care facilities. So these are all University of Michigan health facilities. So the idea is that if we also, some of them have pharmacies embedded. So the idea is that we also may be able to stop at multiple points and pick up inventory from different spots. So we're getting into a little deeper into the logistics business than we ever thought we would need to be, but.
And I think we have two questions here that we hadn't heard from in the back. Yeah, go ahead.
In the zipline system, as it drops the tether, if something happens, like if damage occurs, a dog bites it or doesn't throw this to wind, it would be liable for the damage.
Yes, that is a very good question. So they have thought of everything and tested everything. I think essentially it would detach and we would get a report that says, oh, beep, beep, radar, like Dana's delivery didn't make it, something went wrong. And we would send someone to the field to find out what happened. We have, so specialty prescriptions are high value. They are costly and they are, although the patient's not paying most of the time out of pocket for that, it is a very expensive drug to deliver. So we have a whole network of like insurance layers to protect that. We've actually had truck deliveries catch on fire before. And so depending on the value of what was destroyed, we have an insurance policy that covers that for us.
We have one in the middle and then here and then here. And then we're gonna, after those three, we're gonna go back to your slides. Go ahead.
Punchline too, so we.
Are there any restrictions on what medications can get delivered? Because I know sometimes if you have, like some people will have surgeries and you're prescribed like some sort of opioid, which is kind of a.
100%. We will not be doing, we call them controlled substances. We will not be doing controlled substance deliveries through this. It is too important that that gets to the right individual, to a grown-up that can sign for it. And we're making sure that that chain of command is intact. So this will not include controlled substances.
Here.
Yeah, mine was much along the same lines. I was bringing this up to a lot of my friends this weekend, and for some reason, the unanimous response I got was, well, what's stopping me from hanging out near one of these centers, taking an airsoft gun, one of those hawks that's trained to take down drones? What's stopping me outside of the threat of the law from trying to down one of these and obtain medication? Because inherently prescription medications are valuable, even if we say that's on the low end, it is like $50. What is stopping that from almost incentivizing that crime of, I know that the drone in the air has someone's prescription in it and that is possibly valuable, and I'm gonna take my shotgun or something and try to down it.
This is such a Michigan question. It's funny when this we're like, you guys talk a lot about guns and like shooting down drones. We're like, it will probably happen.
First response they all gave me.
So what they're telling me is that onboard technology would go like this to dodge the bullet, but we'll see if that actually. I mean, I don't have a great answer for that. I think that's one of the challenges. Do we try it and see? And if the theft is too great, I mean, a lot of the reality is a lot of patients that actually need this are in lower socioeconomic regions where theft is higher. And we have, unfortunately, the need for added controls around those deliveries today to make sure either for patients to be home and have them physically sign for it upon receipt, you know, that kind of thing. We have a couple of extra steps in some areas out of necessity to make sure we get the patient what they need. But I don't know. I think we gotta see how it goes. And if that happens, maybe they'd partnership and be like, forget Michigan. I don't know.
Question. It's about what kind of security mechanisms are on the little thing that comes out of the drone to make sure the correct person is the one who's opening it.
Yeah, so the process, and these are all workflows that we have to sort out. So again, I'm happy to be an early partner with them because they're real like practical things. Like how do we connect to our electronic health record and make a note in there that the patient chose this delivery option. So when it comes off the automation, like goes out the dock, it goes to the right mode of transportation, things like that. So that interconnectivity and a lot of questions still about that, like how do we make sure that we know? They're designing an app to go along with the drone delivery. That would be if our patient signs up for it, we would ask that they download it, they set it up. That's where they put in their address and the drone. Actually, behind the scenes, we have an eligibility process. So the other thing that's very Michigan is trees. So a lot of neighborhoods or homes may not even be eligible for drone delivery because there's too much interference or potential for interference. So we have to make sure that their address is eligible, and they use satellite imagery to figure that out. And then the idea is that when they get the delivery on the app, it'd say, hey, Dana, your package is outside on your backyard coffee table. And in some ways, actually, the ability to deliver with that precision can make this more secure than a door. Right now, the truck deliveries don't go to the backyard or don't go to your stoop out back or your little, hidden corner. It goes right on the front door where everybody knows packages are delivered. So in some ways, we think that we could allow patients like a little drop pin selection point to be like, no, if you put it in my backyard, it's less likely to be stolen. Got my guard dog out there, like, who loves drones? I don't know.
So what I'd like.
So then maybe they sign for it, something like that. So we're working on the tools that the patient would interface with us.
What I'd like to do is let Dana finish the last of her slides, and then want to remind you that we want to keep kind of churning through new topics and new ideas. So as we get fixated on, as we all do, right, I'm not going to spend the next 20 minutes thinking about the mechanism by which I sign for it. I want to jump us to what's the next thing we have to think about. And so just remember, your price of admission is you will all speak. So you might want to be thinking about the profound flying monkey insane thing that you're going to say that's just going to spark a great idea, because the last cupcake is saved for the person with the most outrageous idea. Just might work. So Dana, we're going to let you finish without any more interruptions.
Please, no, I like it. Thank you. It's very helpful. The time to fill. So this is a metric that is mapped out here. So number of days, maybe we could do hours or minutes someday, between when a prescription is written by the provider and say, you need this therapy to get well, and the time that they actually get it filled with their pharmacy. So very briefly, the red cohort on this slide is a comparison group. We collect data through what's called the Michigan Value Network. It's a Blue Cross Blue Shield collaborative. So those are patients all across the state of Michigan, and University of Michigan Health has patients in every zip code, UPN, Lower Peninsula, in the state of Michigan, regardless of where they fill. So this could be a patient filling through a Optimum or a CVS pharmacy, et cetera. And the comparison group internally to filling with an in-house pharmacy. So this is our big value equation, that when you fill through University of Michigan Health, we are able to get you your prescription on average 15 days versus 45 when you go to an outside pharmacy. So imagine you have this new disease state you've learned about, you've got a plan, but you can't get started for 45 days, and how that feels. And maybe some of you or your family members have been through that. So we're on a mission to make it faster, and drones being able to do it in 15 minutes, I think would be That's all I got. Have more questions, fire
right.
away.
We're gonna start free for all, and then, as you know, we'll start re-guiding you a little bit, and we also want to make sure that we give everyone a chance to speak, so I may skip some of you if we've had a little bit more time with you, and if we haven't, fire away.
Yeah, I'm wondering, you mentioned the availability and like the eligibility of houses. Do you know what % of the customers you're trying to reach are actually eligible, if their houses are actually eligible? And have you looked into what we were talking about with the other presentation, having like a drop box somewhere else that's closer that would be eligible if their house isn't?
Not yet, and no. No, it's the first time I'd heard the idea of a decoy delivery. It's funny because it's contrary to the time, but even getting it, if that took an hour, that's still much better than 48 hours, right? So that's a fascinating idea to think about, but eligibility is, we just know based on radius right now, and we think there's enough to capture some portion of the patient population. We could get some, we think it's progress, and we'll go from there.
Before we
Our
move on
attitude
from
about
that
it.
point, so you have to lower it on top of something, right? You put it down. So does that mean apartment buildings are?
Actually, it can deviate. It's not a precisely vertical delivery. So one of the reasons Zipline explored this model was because it was more accessible for high density residential buildings. So it can deliver onto a balcony of a high-rise building.
That's pretty cool, very cool.
It's literally exactly what I was gonna ask. Like, does it have the, you mentioned position about coffee tables, could it maneuver to a balcony?
Theoretically, we'll see it when they're still working on it, still getting it right.
Yes. Marina, and then
Bernard.
Maria?
So first of all, I think flying monkeys should deliver my medication. No, but my real question is, I know that certain prescription medications are just not sold in pharmacies, period, so they have to be filled through specialty pharmacy, but for things that could be either or, is your kind of position, your goal to kind of steer people to fill them in-house or outsource them to a commercial pharmacy? And would the calculus in that change with new delivery systems, for example?
Yeah, so this program is being constructed around specialty pharmacy, which is a different supply chain. They tend to be, there are more shortages, they're higher bars to accessing. So because of the price, for example, a lot of insurances require that you get prior authorization, or there's more hoops to jump through to get them into the patient's hands. So this is designed for specialty pharmacy, but Zipline is designed also for like food delivery. We saw that example. They delivered a burrito. Like, it could be more goods and services. We've also talked about a lot of use cases outside of pharmacy. So lab is a really big one. We do a ton of just specimen transport right now. And think about, the issues if you lose something like that stakes are much higher. A drug we can't replace a biopsy, right? So there's like different considerations there, but even supply chain between our facilities, you saw that map with the different locations. We'll send, rapid strep test replacement kits to each of those on a courier truck today. And like, could we just do a lot of that internal materials and supply chain using our drone network instead? We're kind of excited about that. There could be stat deliveries, could be a little bit different. A lot of opportunity.
Yeah, so I think something that stood out to me was when you were talking about how with this drone delivery being an option, it would enable much faster delivery times for any prescriptions filled through the Michigan Medicine Network. So to me, that sounds like a huge competitive advantage, which would make me and presumably other patients more likely to fill their prescriptions through Michigan Medicine. So with that like influx of demand, how like would you account for any like supply chain issues that would exacerbate like with difficulties filling medications?
Yeah, I think in our operational rollout, we'll probably offer it, see how it goes, and iterate and extend instead of like everybody come on, you know. We also are only starting with, I believe, 6 drones to begin, and so like back to the battery question, we've got a lot to learn, so our hope is that we can just start with the patient population that we think will benefit the most and need it the most, that time sensitivity. And then over time, as we see how many we can do in a day or how many patients adopt it as a preference, will grow. The backside of the building that we have is very vast, so there's space to expand. We built it intentionally to be able to expand, so hopefully someday.
And we missed over here, bro.
Sorry about that.
So Zipline started in like Africa with plane delivery, delivering blood hundreds of miles to remote locations. So I was thinking the people who could benefit the most from this kind of model would be like rural Oklahoma, rural Nebraska, where like around Ann Arbor, you know, people need the medications, but they could still get it delivered, right? Like it's a 10-mile radius. Have you guys looked into kind of combining the plane, which has very far range, but not a great delivery system, with this drone, and kind of seeing how far you can go with that?
Yeah, they're two very different, like the infrastructure is totally different. We talked about going live with their first model, which you saw in the Rwanda video. It's like a giant slingshot and it shoots the plane up and then it drops a parachute. So the precision isn't there, but for a rural environment, it's fine, it works. We won't have the infrastructure to do both, but I think that concept of embedded charging along the way is how we'll like leapfrog our way to further distances. They also had some really funky ideas that I don't know how practical they are, but leveraging existing infrastructure. So for example, right now we have freeways and we have semi trucks driving goods everywhere all day long. Could there be charging stations on the rooftop of semi trucks that they can like hop down and get a little buzz and then like fly away, and you know, different like more portable charging things like that that leverage existing realities. They're thinking of a lot of cool ideas. So ideally the 10-mile thing is like just a start and then we'll grow from there.
So I want to take your question and Cynthia, did you still have one? So we're going to take those 4 questions and one on Zoom. And then I want to push back for a flying monkey and I want to tie back to privacy. So we've got, raise your hand if I said you were on the list. 1, 2, 3, 4, 5. And then we're going to talk about some flying monkeys for a minute. So first, you.
I'm thinking more on the patient experience side, and I guess this applies for deliveries in general too, but is there anything is this taking away anything from the patient experience of receiving medication, especially specialty medications? Because I know like when I pick up my medication, there is a question, do you want to ask the pharmacist anything?
Yeah.
Like, do you want to consult with the pharmacist? And usually I say no, because I've been taking the medication for so long, but for especially if they're starting on a new regimen, what is being done to ensure that the patient, is it just that they can send a my chart message or call the pharmacy, or is there something that's being done to address that issue?
That is a really important one. So thank you for raising that question. And I love that you positioned yourself as a patient, because I think that's the most valuable feedback we can get. So we have a couple of things that we're thinking. One is we do have a 24/7 pharmacist already for our specialty pharmacy patients. So if they ever have a question or anything, they can get in touch with us. We have a phone number they can call. We have a lot of virtual pharmacy care. So if they do have access to the portal, we can do a virtual visit and show them how to inject or sit with them. Sometimes it can be overwhelming if you're going to the doctor and you get your prescription, you get home, then you get it and you don't remember what they said about taking it, like upper thigh or lower thigh or left or right, or what am I doing? So that virtual visit component and tying that into their delivery. I mean, maybe we could, because we know that it's delivered, we could like ping them 5 minutes after they get it and say, hey, do you need any help? Now that you're unpackaging it, does it look like what you expected? Thinking about that, like service levels and how to, but you're right, that moment when you pick it up and the pharmacist says, do you have any questions? It could be a disconnect, right? So I think we have to solve for that through virtual technology and making sure patients know that we're here for them.
We're going to come to you next.
Pretty impressive. My question is, it's related to some business model questions, and in such model, do you have some ideas for these common service providers in your business model? For example, the ID reader. system providers, some detective, or I don't know. And also the local facilities varies a lot. So how do you plan to solve this?
The service provider difference is, yeah, so this is where I wish I had Zipline here because we're like, I'm not really the logistics person. We're partnering with them because we're not. Like, we want to be able to get to the point where we send the drug off and then we communicate with our patients and follow up. But what happens between the pickup and the drop off, I think is really where they're the subject matter expertise. I don't feel like I have the expertise to answer that question, to be honest with you, but it is a good one.
Let's take our Zoom question.
Since I've never worked with a drone before, I was curious about who was flying it, whether it needed to be flown by a human or whether it could be programmed.
Awesome question. Yeah.
We're gonna go back to you for that.
So far, you need waivers to fly autonomously. These drones are capable of autonomous flight. So in Rwanda, Zipline is operating like, they call them like 1-to-N operations. So one remote pilot monitoring some number. I think they're up to like 1-to-39, which is insane. So it's one pilot monitoring like 30 to 40 drones. Obviously, they're not like, that person is not manually piloting all 39 of them, right? I don't know what, I think in the US, I don't know if they received the waivers to do autonomous flight. Should have listened to the presentation more clearly last week. So I think they need waivers for autonomous flight, and they also need waivers, more importantly, for what's called BV loss operations, which is beyond visual line of sight operations. So in the US, if you want to fly your drone, someone needs to manually keep an eye on it. And beyond visual line of sight, Zipline has not gotten the waiver yet. In the process, the only company who I know who has it is UPS. So UPS has that waiver, but not Zipline yet.
All right, we'll take yours, please.
Like now we just use drone to deliver pharmacy to patients. Is it possible to use drone to collect patients testing samples? Like during the COVID-19, we need to do some testing, but many testing center can only drive through and to do the testing. But if some people do not have a car, like is it possible to let them to schedule a drone and put their testing samples in it, and then it's fly back to the.
It's a great question. It's bi-directional, right? So we're structured right now only for outbound, but we've talked about that too. We talked about it in terms of the packaging materials. So if we did need to use packaging, styrofoam, et cetera, could we recollect it and bring it back and repurpose it or reuse it until it was no longer viable? So we've talked about that bi-directional, but it involves a whole structure around receiving then and, you know, kind of what do you do with it? But it's another really great use case, I think. It's that ability for us to take care of patients in a remote environment where you do actually need goods to transfer. Or other supplies we've talked about. We have patients on home monitoring who need blood pressure cuffs. Could we deliver a blood pressure cuff and have them send back their device for data uploads periodically? You know, things like that. So I think that could be really a great potential future use case.
So we have about 10 minutes. I'm going to take Cynthia's question, and then those of you who have not yet participated, we want to make sure you're not left out. So we'll be coming to you for our last 10 minutes, and I'm going to be asking in particular to come back to this. So I'm giving you some time to think, but we're coming for you, say, of novel. Let's bring us back to our original, here's a drone that is leaving a building that does nothing but pharmaceutical stuff that is now coming to literally my front porch. I want the creative flying monkey. Nothing is too absurd, because if there's nothing absurd, no one's tried. Crazy ideas. And I know you've already got one, but we're going to try and give you some competition. So Cynthia, and then you get the first flying monkey. All right. All right, go.
Is like Michigan Medicine the only hospital that's trying this out? Like, are we gonna be the first one? Has anyone already done this before? And like, based on the stats you showed, like, it's obviously gonna be reliable, it's cost effective. Like, why aren't there more drones in the sky right now? Doing other stuff, like not just pharmaceuticals, like, I'm just curious.
I think the second answer is back to the FAA and they're figuring it out still, right? Trying to figure that out, but yeah.
All right, we're starting with you. What is your crazy idea for how to deal with the privacy issue?
Don't use it.
What's that?
Just don't use it. Then you don't have no.
Don't use it. Okay. All right. Well, we'll kind of go with that. You want to throw something in and then I'm coming back to you because we skipped you, so I don't want to skip you. Well, you can go first.
It's more of a question, but I guess I don't see the difference between what drones are collecting versus what's already being collected with like apps like Uber Eats groceries or other apps that do deliver groceries. They're already collecting so much data on me as a user. I don't see that much of a difference if drones were being used instead.
I think the difference here is that remote ID is publicly available. So I, as a nobody, can set up a remote ID and collect your data, right?
Okay.
Whereas before I'd have to like sneak into Uber Eats and like steal, right? So it's the both the pervasiveness potentially, and it's the fact that anyone can buy one of these Bluetooth receivers, and truly anyone can, anyone can buy.
Aren't they already selling this like third-party data to like other apps? Like from a vendor perspective, you mentioned it's going to increase competition with like other vendors, but aren't apps like Uber Eats already selling my data to third-party vendors? So why is that more of a concern now? Because that makes sense, but.
No, certainly. I think it's just an additional source, right? It's an additional source that, again, to me, it's this publicly accessible way of retrieving this data. But no, you're absolutely right. Like there is a certain, and actually, one thing I'll say is that 4,000 consumer survey, we put it on GitHub. So if any of y'all want to analyze that, please do, because we've only analyzed a very small sliver. Some of the comments we got was, well, I'm already being tracked anyway. So this is just another, just another tracker. And we also got quite a number of comments, not just from people in Michigan, because we have their states where they reside, or like, if I ever see one of these, I will be shooting it down, right? Not even for like stealing it, right? Just for like, I will be shooting it down. So it's, yeah.
Julie.
I guess one thing I thought about in terms of privacy, like suppose that an organization decided to track everyone who ordered birth control, brings drones, right? And then, there's like a coordinated effort to look at those things. So I think that the publicly available nature of the data does put like potentially people at risk, and in some states more than others, where there's more regulation around like access to certain pharmaceuticals when you think about it that way. So, how do you actually protect that information when it is freely available?
Billy.
I guess the thing that I've been thinking about is with the remote ID, you're posting information about velocities and kind of metadata of the drone itself, but not what it necessarily is carrying at any given time, correct?
Oh, yeah, there's nothing about what it's
So,
carrying, yeah.
You were talking earlier about like decoy stops, right? If you had some central warehouse where you could pick up from the initial pharmacy or health center to pick up whatever it is you're delivering, but then everything goes to a central warehouse that may also service other types of drone companies, then you could kind of transfer packages amongst the different drones. That kind of scrambles the information in that sense.
I mean, I think an even easier setting would be if Michigan Medicine just partnered with all the Starbucks in town to have a charger on their roof, then like if you don't send it directly to someone and you just route it through a couple of Starbucks, I don't know if you ordered Starbucks or if you ordered, or I guess, I only have a less than 100% chance of guessing, right? So it doesn't even, you don't even have to swap packages for anything. You could just land somewhere and do something, right? But yeah, that's a good idea.
Yes.
Why can't we just let
demand drive itself to zero for sensitive items. And then the things that can be delivered with drones like food will, then will lessen ground traffic for sensitive items. And then can be delivered quicker. So just do nothing. And then the patients decide what they want for privacy versus not.
So that's a great point. The issue is no one knows that this is a risk, right? Like you only knew because I told you in this class, right? Like I think most of the public would be like, ah, that sounds good, right? Whatever. So I think, and that's another conversation I've been having with Professor Shaw at the information school is how do you inform people about these privacy risks and maybe nudge them towards more private solutions? But I think that's a great point. Like how do people know instinctively that like this is a privacy risk, right? They'll see this as a really cool new delivery or they don't want to use it, right? I think that's.
Can you follow up though on we didn't talk at all about served capacity, but if I think about one truck coming to a neighborhood with high-rise apartments with 50 packages versus 50 drones coming to that same location. Like when we think about, let's just move everything into the sky and then the stuff that's left will move cheaply on the ground. How much can we fit in the sky? Right? Like, does this make sense in a high density area? Or is this more the rural area where one truck is going to go 10 miles out and 10 miles back just for this one package, right? So I love this idea, and you win my flying monkey, you get 2 cupcakes, because this idea of why are we asking the right question, right? So maybe what we should say is, let's get rid of all of the other traffic. Why are we using? It's not that we want to use drones, it's we want to get it there in a cost-effective way. Get rid of all the other traffic. Now you can just drive it, right? How many drones, like what is the capacity for us to have drones delivering stuff?
I mean, I think, yeah, the context is obviously important because, you know, if you look at the initial deployment in Rwanda, one, it is a more rural place. I mean, sometimes it takes a long time for motorcycles to get to, et cetera. But also, the airspace is less busy there, right? So I think we could do a lot through the air, but right now, like, you know, the FAA is in a very cautious, and they should be, right, in a very cautious, slow to see state. I mean, if I gave, let's say if you had the infrastructure and I gave you 10,000 drones, you could probably handle a lot of these deliveries purely through the air, right? Now the entirety of Detroit, you know, the Detroit radar control facility is now very freaked out about Ann Arbor because they know there's tens of thousands of drones swarming around, right? So I think it becomes both a operational issue, but also just a safety issue. Yeah.
So I want to welcome you to our seminar series and to our department and give you the last comment or question.
Okay.
The crazier the monkeys, the better. And then we'll wrap up. And once again, I came in thinking, how are we going to fill all of this time? And I'm sorry to all of you who've been like, but I have another one. Go ahead, wrap us up.
I guess to your questions about how could you solve this issue of 10,000 drones, similar to a truck, right? You could have the notion of a mothership that's basically flying multiple packages and then it's stopping at each neighborhood and then delivering. So you could achieve the economies of scale that we now have with the truck with a larger drone.
Drive to the corner and disperse. Max, closing remarks for us, and then Dana, closing remarks for us.
No, I thought this was fantastic. I mean, I think certainly this privacy issue is very interesting to me from both kind of an optimization perspective, but also from sort of a design perspective. But I'm excited to see how this progresses because a lot of my other research focuses more on the traffic management and the fleet management perspective, right? So yeah, taking the reverse side of the coin and being like, okay, let's forget about the privacy issue and just how do we make this work operationally within the airspace, right? So I think it's a very interesting time, and I think I'm lucky to be at a university that is exploring this direction. So yeah, I guess I just wouldn't be surprised if I start seeing zip lines flying across. Hopefully that they don't get shot down. So that's the.
Dana?
Yeah, don't.
Okay,
interrupt. We'll end on that note. Just appreciate the opportunity to be here. I too find this very valuable. There's so many things that we don't know yet. I think of innovation as magnificent problem solving, right? So you have to be uncomfortable with not knowing and not having all the answers, but appreciate your brain power and continue to reach out if you think of anything else. I would welcome the feedback and input.
Thank you both.